the care that they show towards their employees. They work with your schedules. They really care about your families and what's going on with you, because they know if the employees are happy, it's going to show in their work production. My name is ShaRon Jones. I'm a licensed practical nurse of 22 years. I've been with Care Options for Kids since 2017. Didn't want to be an RN because I was a little too more in depth. So I wanted something that was quick where I could still be a hands-on with my patients. I've always been hands-on. And I know when you go to school to be an RN, you're more policy and procedure, and I'm more of a people person. So I chose LPN, and I'm happy with it. Even though I went back to school and got a master's in something else, but I came back to this because this is what I really want to do. Home health, I actually feel it's an underserved population. I just felt like I was more needed in the home. You have special needs children, mom wants to work, and it's hard to have a life when you have a special needs child at home. Just something simple as getting your nails done, getting your hair done, the things that most of us women take for granted that don't have a special needs child. When you have a special needs child, it means a lot. Care Options for Kids is one of the best companies I've ever worked for. You're not gonna have that many call-offs if you're happy. You're not gonna have that many call-offs if people feel like you're working for a company that care about what's going on with you. And whatever the staff was in that company, everybody has always cared about me. They've always been there for me, and I've always been there for them, and that's why I'm still here. They ask you, what do you like? They ask you, what are your choices? What side of town you want to go on? How far you want to drive? All of that makes a difference too. I don't want to drive an hour when I can drive 10 minutes up the road. That makes a difference to a nurse. You don't want to drive somewhere, work 12 hours, you tired, then you got to drive, you got to stay in traffic 45 minutes to an hour to get home. All of that makes a difference. And they go out their way to say, they ask you where you want to go and where you don't want to go. I got stuff everywhere. You tell me where you want to go. They give you the choice. So you can't say, well, I didn't want to drive way out here. They give you the choice. They tell you, this is what we got. You tell me what you want. We'll do a meet and greet. I advise any nurse, do a meet and greet first. You know in 15 minutes if this ain't where you want to be for 12 hours. You know in 15 minutes. When you walk in the door, you know. I tell anybody, do a meet and greet first. That's the first thing I would advise anybody. Do a meet and greet. That little bit of gas will save you a whole lot of headache. Because home health is not for everybody. Luckily for nurses, we do have different fields we want to go into. I never wanted to work in the hospital because I worked as a tech. And I knew when I became a nurse, that ain't what I wanted to do. I wanted to go into the home field. But I would also say, if you get out of anything, what you put into it, and home health is no different. But this is a good place to start. It's one of the best companies you can ever work for. So if you start with a good company, what you put into it is what you're gonna get out of it. It's just that simple.